everyone, welcome to my YouTube channel. I am going to upload the whole syllabus of anatomy including upper limb, lower limb, thorax, abdomen, pelvis as well as CNS. I have already completed with the lower limb session and I have started with abdomen and pelvis. Our today's topic is prostate gland, which is a very important topic for university exam. In my exam also it came for 10 marks. So let's begin with the introduction. It is the accessory gland of the male reproductive system. Accessory, which means it is an extra gland, not an essential one. Secretion of this gland is added with the seminal fluid, with seminal vesicles and bulbourethral gland secretions. These are the parts of male reproductive system. It is formed due to dense fibromuscular stroma. इसके पास बहुत फाइब्रोमस्कुलर स्ट्रोमा की वजह से ये एकदम फर्म अटैच है. In females, it is represented by paraurethral glands of skin. फीमेल में भी ऐसा एक ग्लैंड होता है जिसको paraurethral gland of skin बोलते हैं. Now situation, it lies lesser pelvis में, below the neck of the urinary bladder, behind the lower part of the pubic symphysis and upper part of the pubic arch and in front of the ampulla of rectum. तो situation के लिए 5 points. Lesser pelvis, below the neck of the urinary bladder, behind the lower part of the pubic symphysis, upper part of the pubic arch, in front of the ampulla of the rectum. Size, it is like an inverted cone, 4 cm transversely at the base. Width is 3 cm length vertically, 4 cm transversely at the base. Then 3 cm length vertically, this is 3 cm length vertically and 2 cm thickness at the anterior posteriorly. Anterior posteriorly 2 cm thickness and it weighs about 8 gram. 4328. 4 cm transversely at the base, 3 cm vertically length, 2 cm thickness anterior posteriorly and it weighs about 8 gram. Features, it has apex, base and 4 surfaces, anterior and posterior and 2 inferolateral surfaces. Now let's see the relation one by one. Apex, which is directed downwards, surround the junction of prostatic and membranous part of prostatic urethra. Separated from the anal canal by the perineal body. Base is upward, continuous with the neck of the urinary bladder. This is the base is upwards and this is the neck of the urinary bladder. It is continuous with the neck of the urinary bladder. Now it is marked by the junction by circular groove, which contains the venules of vesicle and prostatic plexus. Surfaces, anterior surface, posterior surface and 2 inferolateral surface. Now anterior surface, which is narrow and convex from side to side. 2 cm behind the pubic symphysis with the retropubic fat. Upper part is connected with puboprostatic ligament to the pubis bone. Upper part is connected to the pubis bone with the help of puboprostatic ligament. Lower part is pierced by the urethra and the lower part of the urethra emerged anterior superiorly to the apex. Posterior surface, it is triangular in shape, flattened from side to side and convex above downwards. It is separated from the rectum by the fascia of Denonvillers or rectovesical pouch of peritoneum. Near upper border, east side of the median plane by the ejaculatory duct. So it is separated from the rectum by the rectovesical pouch of peritoneum, which is a rectovesical pouch which is present between the rectum and the urinary bladder. That it is separated from this the fascia of Denonvillers. This rectovesical pouch also called as fascia of Denonvillers, and near the upper border east side of the median plane by the ejaculatory duct. Upper border, it is related to east side of the median plane by ejaculatory duct. Now the surface lies 4 cm from the anus and can be palpated. This posterior surface, it lies 4 cm from the anus and it can be palpated. Now inferolateral surface, it is related to the side wall of the pelvis, anterior fibers of levator ani and closes the gland in the pubourethral ring. It is separated from the muscles by the plexus of veins. So this is the diagram of urinary bladder. Here this is the trigon of the urinary bladder. Inside the urinary bladder we have this trigon. These are the ureters, and this is proximal urethral sphincter. This is your prostate gland. This is levator ani muscle, and these are distal urethral sphincter. This is proximal urethral sphincter. This is prostate gland, which is surrounded by the prostatic venous plexus. Here we have a perineal membrane, and these are pulbourethral gland. Now there are different zones of the prostate gland. According to McNeil, glands are divided into three parts: peripheral zone, central zone, and periurethral or transitional zone. So this is the diagram. This is central zone, this is peripheral zone, and this is the transitional zone. This is prostatic sphincter. Peripheral zone, it is 70% glandular tissue situated posteriorly and cancer vulnerable. There are there are high chances of getting cancer. Now central zone, it is 25% of the glandular tissue. It consists of 25%, which is situated posterior to the urethral lumen and below the ejaculatory duct. This is the central zone. It is situated posterior to the urethral sphincter, and it is below the ejaculatory duct. Ejaculatory duct के पीछे, नीचे. Now two zones are like egg in its egg cup. These zones are like egg in a egg cup. It is compared to a egg cup, and central zone is not involved in any disease. There is no chances of any disease. It is of a Wolffian duct origin. Periurethral transition zone, which is 5%, and it is the most common part of causing benign prostatic hyperplasia, benign prostatic hyperplasia, which is more common, and it occurs in the periurethral and transition zone. Central zone and transition zone together called is central gland. Now it has different sphincters: internal urethral sphincter and distal urethral sphincter. This is a proximal urethral sphincter and distal urethral sphincter. Internal urethral sphincter situated to the pre-prostatic part of the urethra. Function: sexual function of closing during ejaculation. It falls, the retrograde ejaculation occurs. If it fails. Distal urethral sphincter situated at the junction of prostatic and membranous part of the urethra. It is horseshoe shaped with most of bulk lying anteriorly. It is distinct from the muscle of the pelvic floor. This is distal urethral sphincter. Pelvic floor के muscle से थोड़ा distally passed. Levator ani muscle से थोड़ा distance पे है. Lobes. Earlier it was described as 5 lobes: anterior, posterior, median and 2 lateral. Now new classification has divided into 3 lobes: 2 lateral lobe and 1 median lobe. Capsules and ligaments. It has 2 types of capsules: true capsules and false capsules, and some ligaments. True capsule, which is formed by condensation of peripheral part of the gland, and false capsule lies outside the true capsule, which is derived from the endopelvic fascia. Ligaments. 4 ligaments which support the gland. A pair of medial puboprostatic ligament and a pair of lateral puboprostatic ligament. 2 medial puboprostatic ligament and 2 lateral puboprostatic ligament, which extend from the false capsule to the back of the pubic bone. Medial pair lies near the apex and lateral pair lies near the base. This is medial puboprostatic ligament and this is lateral puboprostatic ligament. So this medial puboprostatic ligament lies near the apex. It lies near the apex because the shape of prostate gland is inverted cone. So apex is downwards. It lies near the apex, and the lateral puboprostatic ligament lies near the base. Structures. There are some structures which are present in the prostate gland. Prostatic urethra, which transverse vertically at the junction of anterior 1/3 and posterior 2/3. Prostatic utricle, which is a blunt sac directed backward, ejaculatory duct, which is downward forward open in the prostatic urethra. Structural zone, two well-defined zones, especially separated by the ill-defined irregular capsules. Outer larger zone and inner larger zone. Outer larger zone, it is large branched gland, ducts open into the prostatic sinuses, and it is a site of carcinoma. There are very high chances of getting cancer in this zone. Then inner larger zone, submucosal glands open into this prostatic sinuses, contain the simple mucosal gland, and it is a site of hypertrophy. Outer zone is a site of carcinoma and inner zone is a site of hypertrophy. Blood supply, inferior vesicle, medial rectal, internal pudendal artery. Which are the branches of this artery forms the outer subscapular plexus and inner periurethral plexus. Outer subscapular plexus has the greater blood supply. So 1, 2, 3, three arteries together form two types of plexus. Outerly subscapular plexus and innerly periurethral plexus. So subscapular plexus gives a greater blood supply to the prostate gland. Venous supply, it is rich plexus from the rich plexus around the gland, which communicates with the vesical plexus and internal pudendal vein and drain into the vesicle and internal iliac vein. So in this diagram, as we can see, it is surrounded by the prostatic venous plexus, which forms communicate with vesical plexus also and internal pudendal vein also, and all together drain into the vesicle and internal iliac vein. Lymphatics drain into the internal iliac and sacral nodes. Nerve supply, prostatic plexus of the nerves, which is derived from lower part of inferior hypogastric plexus. तो जो prostatic plexus of nerves है वो drive होती है from lower part of inferior hypogastric plexus. So as we can see in the diagram, this is urinary bladder, lateral puboprostatic ligament, which is near to the base. Then medial puboprostatic ligament, which is near to the apex. This is true capsule. This is false capsule. And between true and false capsule, we have venous plexus. So this was all about the prostate gland. It is a very important question as point of view of your university exam. So I hope you understood the topic. If there is any query, any question, do comment in the comment section. And if you understood the topic, subscribe to my channel.